Let's dive right in today. We're tackling Canadian healthcare and specifically
Yeah,
this report from McKinsey about the potential of AI to really shake things up.
it's fascinating stuff.
It is. And it's timely, too, published just this past February.
Uh-huh.
They're looking at this big issue. Healthcare costs are going up, up, up.
Right.
But are we seeing outcomes improve at the same rate?
That's the question, isn't it? And I think a lot of Canadians are feeling that disconnect.
Absolutely. So the report dives into how AI could be a game changer.
Potentially a huge
Really,
game changer.
like streamlining all that admin stuff, improving the quality of care we receive, maybe even making healthcare more affordable.
That's a big promise.
It is. So let's paint a picture of where we're at now.
Okay.
What's the lay of the land in Canadian healthcare?
Well, Canadians are spending a lot on healthcare. A lot.
Yeah, I saw that figure in the report, something like $330 billion.
That's right. 330 billion Canadian dollars in 2022 alone,
Wow.
which works out to 12.2% of our GDP. That's one of the highest rates globally.
So big spending, but are we getting our money's worth, so to speak?
Well, that's where things get interesting, because even with all that spending, Canada's performance isn't exactly top tier.
Really?
Yeah. For example, we lag behind other developed nations when it comes to wait times.
Oh, you mean how long it takes to actually get treatment?
Exactly.
Yeah.
The Fraser Institute, they do a lot of research on this.
Right.
And their findings show that Canadians are waiting longer than folks in other comparable countries.
I've definitely heard those stories.
Yeah, and it's not just wait times. We've got a population that's aging, more people living with chronic diseases, and new treatments are often really expensive.
Okay, so we've got this kind of perfect storm brewing. Lots of pressure on the system.
Yeah, you could say that.
So is that where AI steps in? Like, is that the big solution?
Well, the report definitely explores AI as a potential solution.
Okay.
And it's not just some far-off futuristic thing either. AI is already being used in healthcare right now.
Oh, really?
Oh, yeah. You've got machine learning, which is essentially using data to teach computers to make predictions. So,
Right.
like right now, machine learning is being used to help interpret X-rays.
Wow, so AI is already helping doctors make diagnoses.
In a way, yes. It's more like providing them with another tool to be more accurate.
I see.
Then you've got natural language processing.
Okay. Never heard of that one.
Basically, it helps computers understand and process human language.
Huh.
Okay, so for example, it can be used to convert a doctor's voice notes into written text.
Oh, that makes sense. So no robot surgeons just yet?
Not quite.
But AI is definitely already in the mix.
It is. And then there's this whole other level, generative AI or Gen AI.
That's what everyone's talking about.
It is. It's super exciting because generative AI can actually create new content.
Like what kind of content?
I mean, we're talking text, images, even code. So think about it. AI could help doctors diagnose patients more accurately, come up with personalized treatment plans, maybe even communicate with patients more effectively, like in plain language they can understand.
The potential is mind-blowing. Okay,
Yeah.
so the report breaks it down into 3 areas where AI is already impacting healthcare.
Yeah.
Let's start with public health. What's AI doing there?
Well, imagine being able to predict and track health trends like infectious disease outbreaks.
Oh, that would be amazing.
Yeah, so AI could help with that, and that would mean more targeted public health interventions.
Okay, so you could focus resources where they're really needed.
Exactly, and potentially prevent outbreaks before they even start.
Okay, that makes sense.
Well-
What about the second area, care delivery? How is AI changing things for doctors and nurses on the front lines?
Think about faster, more accurate diagnoses.
Oh, yeah.
Imagine AI helping doctors analyze, I don't know, a CT scan or something,
Right.
and spot something tiny that a human eye might miss.
Oh, wow.
Or it could help create a personalized treatment plan based on your unique genes or your medical history, really taking personalized medicine to a whole other level.
That is next level. And then the third area is capacity management.
Mm-hmm.
Now, I'm not really sure what that means. Can you break that down for me?
So it's about making the best use of resources, which is crucial, right?
Yeah, especially in healthcare, where resources are often stretched so thin.
For sure. So AI could help predict staffing needs, maybe streamline how hospitals operate, even manage supplies better, make sure there's enough of what's needed when it's needed.
So it's like AI could be the air traffic controller for the whole healthcare system.
Kind of, yeah. Making everything run smoothly and efficiently.
Okay, so it all sounds great, but here's the big question. Can AI actually save us money?
That's the million-dollar question, isn't it? Well, the report suggests that AI could potentially save Canada
Go on.
between $14 and $26 billion every year.
Whoa, wait, billions with a B.
Billions with a B. That's a serious chunk of change.
That's incredible. But where are these savings coming from?
Well, a big chunk of it would come from using AI to reduce hospital readmissions. Like, imagine if AI could help identify patients who are at high risk of needing to come back to the hospital,
Right.
and then they could intervene early, maybe adjust their treatment plan or something.
So preventing those extra hospital stays?
Exactly, because those extra stays, they cost the system a lot of money.
Yeah, and they're not good for the patient either, I imagine.
Of course not. They want to be home recovering, not back in the hospital if they can avoid it.
Absolutely. So reducing readmissions, that's just one example, right?
Oh yeah, just one example. I mean, the potential cost savings really touch every aspect of the system, from how appointments are scheduled to how medications are prescribed.
Pretty amazing to think about. Okay, so we've talked about the potential, but are there any real-world examples of AI already making a difference in Canada, like success stories?
Absolutely. There's this company called Swift Medical,
Okay.
and they've developed this AI-powered platform that focuses on wound care. Yeah, and it's already helping reduce the number of people who need to go to the hospital or the ER because their wounds aren't healing properly.
So it's like catching those problems early.
Yeah, exactly. And because the AI helps clinicians make better treatment decisions, patients are recovering faster too.
That's fantastic.
Yeah.
AI literally helping people heal faster.
That's the power of it. And it's not just Swift Medical. There are other companies doing amazing things too.
Like who? Tell me more.
Well, so there's this company called BIOS, and they've partnered with Mila. It's a leading AI research institute here in Canada.
Okay.
And together they're developing something called a closed-loop neuromodulation system.
Okay, you're going to have to break that down for me. What is that?
Think of it like a super smart pacemaker.
Okay.
But instead of just keeping your heart beating regularly,
Right.
it uses AI to constantly adjust its settings based on your heart's needs, all in real time.
Whoa, that is some seriously futuristic stuff.
It is, and it has the potential to treat not just heart conditions, but other chronic diseases too.
So AI could be the key to managing all sorts of chronic illnesses.
Potentially, yeah. It's really exciting to think about.
It is.
Yeah.
But it can't all be sunshine and roses, right? There have to
Yeah.
be some challenges, some risks involved with all of this.
Oh, absolutely. I mean, bringing AI into healthcare, especially on a large scale,
Yeah.
it's not without its hurdles. The report acknowledges that too.
Okay, good. So they're not just sugarcoating it.
Not at all. One of the things they emphasize is the need for strong data governance.
Okay, what does that mean exactly?
So AI relies on huge amounts of data, right, to learn, to make predictions.
Right.
But that data needs to be accurate and it needs to be used responsibly.
Yeah, that makes sense.
We need to be careful about things like bias in the data.
Oh, right. Like if the data used to train the AI is skewed in some way.
Exactly. So it's not just about the technology, it's about all the safeguards we put in place around it.
So planning and execution are key.
For sure. We need to invest in the right technology, train our healthcare professionals to use it effectively, make sure it integrates smoothly into the existing system.
So no quick fixes here.
No, it's a long game. We need to think long term.
Okay, so what are the key ingredients for success? What needs to happen to make this whole AI thing actually work in Canadian healthcare?
Well, the report lays out a few important steps. First off, Canada needs to invest in some foundational stuff,
Like what?
like standards and infrastructure. Think of it like building a house,
Okay,
You need a strong foundation.
makes sense.
So in healthcare, that means developing shared standards for data, making sure different systems can talk to each other.
Okay.
And we need to invest in the computing power to make all this AI stuff actually work.
So basically building the right environment for AI to thrive.
Exactly. And it can't just be about implementing individual AI projects here and there.
Right.
We need to think bigger picture, What's the long-term impact of AI on the whole healthcare system? How does it fit into Canada's overall healthcare priorities?
So strategic thinking is key.
Absolutely.
And we can't forget about trust.
Right. People need to trust this technology.
Both the people providing healthcare and the people receiving it.
I imagine that's a big one. People can be wary of new technology.
For sure. Patients need to feel confident that their data is being used responsibly,
Yeah.
that AI is there to enhance their care, not replace human connection.
So striking that balance is important.
Definitely. And healthcare workers need to feel assured That AI is there to support them, not replace them.
That makes sense, and that probably leads to the need for some serious training.
You got it. We need to invest in training and education to prepare healthcare professionals for this AI-powered future.
What kind of training?
Well, they need the skills to work effectively with AI, understand its limitations,
Right.
advocate for its responsible use. It's about empowering them to be AI-savvy partners in delivering better care. That's a great way to put it. Partners in care, not replaced by robots.
Exactly, because at the end of the day, it's about the patient, right?
Absolutely. So it's about finding that sweet spot, using AI to enhance the human side of healthcare, not replace it.
Exactly. Technology should serve humanity, not the other way around.
Well said.
Yeah.
Okay, but I keep coming back to those risks we were talking about. What are some things we need to watch out for, to make sure AI is used responsibly?
That's a really important question. And the McKinsey report actually dives pretty deep into that.
Okay, good.
They emphasize the need for, strong risk management frameworks,
Okay.
clear ethical guidelines, and constant monitoring, to ensure this AI is used safely and effectively.
So we can't just set it and forget it.
No, it's not like that. We have to be proactive. We have to ask ourselves, how do we make sure these algorithms aren't perpetuating biases?
Right. Biases that already exist in our systems.
Exactly. And how do we protect patient privacy? How do we make sure there's transparency about how AI is being used in healthcare decisions?
Yeah, these are big questions.
They are, and we need to keep asking them as AI becomes more and more integrated into healthcare.
For sure. Okay, let's shift gears a bit and focus on the potential benefits again. McKinsey's report suggests that AI could lead to significant savings, potentially billions of dollars. Where would those savings come from specifically?
Well, a lot of it would come from reducing those hospital readmissions we were talking about.
Yeah.
But AI could also streamline administrative tasks, freeing up more time for doctors and nurses to spend with their patients.
So less paperwork, more face-to-face time.
Exactly. And AI can also help optimize how resources are allocated, making sure that patients are getting the right care at the right time in the right setting.
Okay, so it's about improving efficiency, reducing waste, and getting more bang for our buck, so to speak.
Precisely. And all those cost savings can then be reinvested back into the system, which could lead to even better care for everyone.
It's a win-win. The report also talks about public health as being a key area where AI could make a difference. Can you give me some concrete examples of that?
Absolutely. Think about using AI to predict and track disease outbreaks. That could be a game changer.
Oh, yeah, we talked about that a bit earlier.
Right. And AI can also help personalize public health messaging, making sure the right information reaches the right people.
Okay, so like targeted campaigns.
Yeah, exactly. And it can help tailor public health interventions to the needs of specific communities.
That makes a lot of sense, especially with all the different health challenges people face.
For sure. And speaking of different challenges, what about chronic diseases? So many Canadians are living with conditions like diabetes and heart disease. Can AI help there?
Yeah, that's a big one.
It is, and AI can definitely help. Imagine using AI to create truly personalized treatment plans for people with chronic conditions.
Okay.
It could monitor their progress remotely and maybe even predict potential complications before they arise.
So it's like having a virtual health coach.
In a way, yes. AI can help people stay on top of their health and manage their condition more effectively.
That's incredible. It sounds like AI could really help people with chronic illnesses live longer, healthier lives.
That's the hope. And we can't forget about mental health, another area where AI has huge potential.
That's so important.
It is. AI-powered tools could help detect mental health issues early on,
Okay.
maybe offer personalized therapy options, or even provide 247 support for people in crisis.
Wow, that would be amazing. There's such a huge need for more mental health support.
Absolutely. And AI could help fill some of those gaps.
So we've got public health, chronic diseases, mental health, and those are just a few examples, right? It seems like AI has potential applications across the entire healthcare spectrum.
Oh, for sure. I mean, we haven't even touched on things like drug discovery, clinical trials, medical imaging analysis.
It's a bit overwhelming to think about all the possibilities.
It is, but it's also really exciting.
It is. Okay, but I want to bring it back down to earth for a moment. What about the people involved in all of this? The patients and the healthcare professionals. How do we make sure they're on board with this AI revolution?
That's a great question. And building trust is absolutely key. Like we've said, patients need to understand how their data is being used, how AI factors into their care, and what benefits they can expect.
So no surprises.
No surprises. It's all about transparency.
So clear communication is key, making sure patients feel like they're in the loop.
Exactly. And it's about making them active participants in their care, not just passive recipients.
I like that, empowering patients.
Exactly. And the same goes for healthcare workers. They need to be part of this process, too.
What do you mean?
Well, they need training on how to use AI effectively, for one.
Okay.
And they need to feel confident that AI is a tool that supports them, not something that's going to take their jobs away.
Right, it's about collaboration, not replacement.
Exactly. And that's why I think it's so important to bring everyone to the table.
What do you mean?
I mean, patients, clinicians, researchers, policymakers, everyone. We need to have an open dialogue about the role of AI in healthcare.
In national conversation.
Exactly. And that conversation should cover the ethical implications, the social implications, all of it.
Okay, so we need to talk about not just the how of AI, but also the why.
Exactly. And that's the best way to create a system that works for everyone, a system that reflects our values as Canadians.
I think that's a great place to start. Okay, so we've talked about the potential of AI, the challenges, and the importance of building trust. But what can we actually do today to start making this vision of an AI-powered healthcare system a reality? What are the concrete steps?
Well, McKinsey report offers some great recommendations, and one of the key things they highlight is the need to invest in building a strong AI ecosystem.
Okay, and what does that look like?
Well, it means supporting research and development, fostering partnerships between universities, industry, and healthcare providers.
Mm-hmm.
And it also means creating regulations that encourage innovation while upholding ethical principles.
Okay, so we need to create fertile ground for AI to thrive.
Exactly. Another crucial element is data infrastructure.
Okay, we talked about data governance before, but what do you mean by infrastructure?
I mean, AI needs data to learn and grow, right? So we need to make sure that healthcare data is accessible, secure, and standardized.
So breaking down those data silos that we hear so much about.
Precisely. And that requires investment in data sharing platforms that prioritize privacy.
Okay, so we need a modern, data-driven healthcare system.
We absolutely do. Another key area is fostering AI literacy across the entire healthcare system.
Okay, what does that involve?
Basically, it means providing training and education for healthcare professionals on the fundamentals of AI, its applications, and its ethical implications.
So making sure they understand this technology and how to use it responsibly.
Exactly. And finally, we need a system for monitoring and evaluating the impact of AI.
Okay, so like tracking how it's being used and what the outcomes are.
Precisely. That way, we can identify best practices, address any potential biases, and make sure that AI is delivering on its promises.
So constant evaluation and improvement.
Absolutely. Because AI is not a one-time fix. It's an ongoing journey. We need to be flexible and adaptable, always striving to optimize its use in healthcare.
That makes sense. This is all so exciting, but I can also see how it could feel a bit overwhelming. Like, where do we even begin?
Well, the good news is that Canada is already a leader in the field of AI.
Oh, really?
Yeah, we have world-class researchers, a strong innovation ecosystem, and the will to make this happen.
So we have the talent, we have the drive.
We do. We have all the ingredients for success.
That's reassuring to hear. But Canada's healthcare system is pretty complex, with different provinces and territories each doing their own thing. How do we navigate that?
That's a valid point. Our decentralized healthcare system definitely presents unique challenges, but it also creates opportunities for innovation and experimentation. Well, think of each province and territory as a testing ground for different AI applications.
Okay.
They can share their successes, their failures, and that can help everyone learn and improve more quickly.
So a little friendly competition could actually benefit the entire country.
Exactly. And we can also look to national organizations like the Canadian Institute for Health Information, CIHI, to help coordinate data sharing,
Okay.
maybe standardize best practices, and create a more unified approach to AI in healthcare.
So working together to find solutions that benefit all Canadians.
Exactly. It's about leveraging our collective knowledge and expertise to make sure no one is left behind.
That's a great point. And I imagine engaging with Indigenous communities is crucial as well, given the unique healthcare challenges they face.
Absolutely. And AI has the potential to bridge those gaps and improve access to care in remote and underserved areas.
That's really important. Equity and inclusivity have to be front and center as we move forward with AI and health.
Couldn't agree more. AI has the power to make high-quality healthcare accessible to everyone, regardless of where they live or their background.
That's a vision worth striving for.
It really is.
Okay, but let's not shy away from the potential downsides. We've heard a lot about AI bias, about the possibility of job displacement. How do we make sure those don't overshadow the potential benefits?
Those are valid concerns, and we need to address them head on. When it comes to bias, we need to make sure that AI algorithms are trained on diverse data sets. We need ways to identify and mitigate bias in the system.
So being proactive, not just hoping for the best.
Exactly. As for job displacement, I think it's important to remember that AI is not about replacing healthcare workers. It's about making them more effective.
It's about augmenting their skills, not eliminating their jobs.
Precisely. And we need to invest in training programs to help healthcare workers adapt to this changing landscape and really embrace the opportunities that AI presents.
Okay, so preparing the workforce for the future.
Exactly. And who knows, maybe AI will even create new jobs in healthcare. We'll need people who can develop, implement, and manage these AI systems responsibly.
So it's about being proactive, not reactive.
Precisely. It's about embracing the potential of AI to create a more efficient, equitable, and patient-centered healthcare system.
And that's something we can all get behind.
Absolutely.
This has been a really fascinating conversation. I feel like I've learned so much. But let's circle back to our listener who sent us this McKinsey report. They're clearly interested in this topic. What's the one key takeaway they should remember?
I think the takeaway is this. AI has the power to fundamentally improve healthcare in Canada. It can enhance the quality of care, improve patient experiences, and create a more sustainable system. But to make that happen, we need a thoughtful, collaborative approach. We need to prioritize ethics, equity, and patient-centered care every step of the way.
It's not just about the technology itself. It's about how we choose to use it.
Exactly. AI is a tool, and like any tool, it can be used for good or for ill. It's up to us to guide its development and make sure it benefits all Canadians.
That's a powerful message. And speaking of taking action, what's one thing our listener can do right now to learn more about AI in healthcare?
I would encourage them to explore all the amazing resources available online. Organizations like the Vector Institute, Mila, and AMI provide great insights into Canada's AI landscape. They could also check out the websites of companies like Swift Medical and BIOS, which are already making a difference in people's lives.
So do your own deep dive.
Exactly. And if they're feeling inspired, they could reach out to their local healthcare providers or policymakers and ask about AI initiatives happening in their community. Who knows, maybe they'll spark a conversation that leads to positive change.
It's empowering to think that we all have a role to play in shaping the future of healthcare.
We absolutely do. And AI can be a powerful ally on that journey.
Okay, so lots of potential, but also some big questions, some things to watch out for.
Yeah.
We've got to be smart about how we approach all of this, right?
Absolutely. We can't just assume AI is going to swoop in and magically solve all our healthcare problems.
Yeah, that's what I'm thinking. It feels like a tool, not a solution in and of itself.
That's a great way to put it. It's a powerful tool, but its success really depends on us.
On how we use it.
Exactly. Think of it like building a bridge.
Yep.
You need a solid plan, you need the right materials, and you need skilled engineers to make it all come together.
Yeah.
AI in healthcare is the same. We need a strong foundation of data, a clear vision for how we want to use it, and healthcare professionals who are trained and ready to embrace it.
So it's not just about throwing technology at the problem.
Nope.
It's about using it strategically, thoughtfully.
Exactly. And we need to consider the impact on everyone involved, you know? What does this mean for healthcare workers? How do we make sure it benefits all Canadians?
Yeah, those are important points. And it all comes back to trust, doesn't it?
Trust is huge EE. If people don't trust this technology, it's not going to work.
Exactly. So how do we build that trust?
Transparency is key.
Okay, so being open about how AI is being used.
Exactly. People need to know what data is being used, how AI is making decisions, what safeguards are in place to protect their privacy.
No secrets.
No secrets. The more open we are, the more comfortable people will feel.
That makes sense. What about patient involvement? Should patients have a say in how AI is used in their own care?
Absolutely. It's crucial to involve patients in these conversations, give them a voice.
Okay, so not just telling them what's happening, but actually listening to their concerns.
Exactly. It's about empowering them, not just treating them as passive recipients of care.
I like that. Empowerment, not just treatment.
And education plays a big role too, you know.
Education about AI.
Yeah, we need to demystify it.
Okay, so explain it in plain language that everyone can understand.
Exactly. People need to understand both the potential benefits and the limitations of AI.
So no hype, just the facts.
Exactly. Informed consent, right.
Yeah.
People need to be able to make informed decisions about their own health.
Absolutely.
Yeah.
It sounds like what we really need is a national conversation about AI in healthcare.
100%. We need a dialogue that includes everyone, patients, doctors, nurses, policymakers, researchers, everyone.
Everyone has a stake in this.
They do. And that conversation needs to cover the ethical implications, the social implications, all of it. We need to be thinking about these things now before AI becomes so embedded in our healthcare system that it's hard to change course.
So setting those guardrails early on.
Exactly. This technology is powerful, and we need to use it wisely.
Couldn't agree more. This deep dive has been really thought-provoking.
It's been great talking about all this.
It has. Okay, so we've talked about the potential, the challenges, the importance of trust. But before we wrap things up, I want to leave our listener with a final thought.
Okay.
We've talked a lot about efficiency, about personalized care, but what about AI's potential to fundamentally change our relationship with healthcare, like how we think about health and wellness?
That's a great question. It's something we should all be thinking about. Imagine a future where AI empowers us to be more proactive about our own health,
Okay.
where it helps us make healthier choices, connect with the right care at the right time.
So less about reacting to illness
Right.
and more about preventing it in the first place.
Exactly. Shifting from a focus on sickness to a focus on wellness. That's the power of AI. It's not just about treating disease. It's about creating a healthier future for everyone.
I love that. Okay, that's a great note to end on. Thanks so much for joining me on this deep dive.
It's been a pleasure. This is such an important conversation, and I'm glad we could have it.
And to our listener, thanks for sending us this thought-provoking report
Mm.
and for joining us on this journey into the world of AI in Canadian healthcare. We hope you found it informative and maybe even a little bit inspiring. Until next time.